Well, folks, we're visiting today with Malene Davis. Malene is the founding president and chief visionary officer of West Virginia Caring from Arthurdale, West Virginia, in Preston County. Malene, thanks for being on the show today.
Jim, it's a real pleasure to be here. It's good to see you.
Yeah, it's great to have you here in the studio, and I look forward to learning more about West Virginia Caring.
Positively West Virginia is powered by Breezeline high-speed fiber internet and sponsored by Highmark West Virginia, Freedom Key of Morgantown, and Storymaker. With the help of these sponsors, we are able to share the positive business stories of West Virginians, including the one featured in today's episode.
Malene, tell us about what it is you do at West Virginia Caring.
West Virginia Caring is a really old hospice in the state as ages go, and one of the largest. And what we do is really in-home hospice care for people that have been told by their doctor, specialist, that essentially whatever is ailing them, any disease that's going on, really has reached the end of treatment. And whether that's cancer or end-stage respiratory illness or any kind of neurological, respiratory, any system failure that's happening, people really have reached the end of what could be done about it. But there is a lot of care that can still be done, and people still have bucket lists. And so hospice care uses a team of resources from, of course, medical, nursing, social work, spiritual, all the senses, all the makeup of the body, to essentially address a person's life and to get the most out of whatever's left, whether it's weeks, months, years, whatever it is. And so we've been doing it for over 4 decades now. And mostly 90-something% is in your own home. We also go into nursing homes and assisted livings because that is the home of that person. And then we also do some inpatient care.
Yeah. So, Malene, you're the founding president, chief visionary officer. This kind of whole thing was your idea, in essence, back in 1983, I believe. And how did you get inspired? Like, what was the need out there that you saw that kind of forced you into, like, hey, I want to take some action and do something about this?
Well, it's really an interesting story because, to me anyway, but I think that, I was in nursing, and so I was working at the hospital, and was working on an oncology floor, and very different than oncology today. But we were, seeing a lot of women on that floor who had different GYN issues and things like that, of all ages, both people that were in their 30s, 40s, 50s, and older, and I noticed that I just had a concern, and it's probably how I was raised, about what, I would ask them questions about what was going to happen to when they got home. Who's going to be caring for you?
You were curious.
I was curious about what was going on. And I noticed that I would go in, and probably not an exciting thing for some administrator of a hospital today, but, I'd take a bag and I would put supplies in there and kind of like a take-home bag, because I was really, concerned about that. And then I was also simultaneously really thinking about how a healthcare entity runs. It's just like, it seemed like a lot of people are not very happy all the time. And they, it just seemed like there was a disconnect between, what the hospital needed, from a fiduciary standpoint, but actually what was happening on the floor and so forth like that. And so I went back and got a master's in business degree, thinking that I probably was going to take an exit here, take the off ramp, and go in a different direction. And then it was through my business school that they said, you could combine these 2 degrees and actually do something.
Wow.
And so, in nursing school back then, we did not teach about end-of-life care. Unfortunately, they don't get 5 stars today either, but that was not talked about. So, it kind of 2 and 2 together. And I swear I really just ended up having this kind of passion for it, but I wasn't sure how to exactly manifest it. And so I answered an ad. I swear, I laugh. It was about the size of a Splenda packet. It was this big. And they were looking for an executive director, this group of, a little group of doctors and a couple nurses and a business guy.
Yeah.
And, when I went for the interview, one thing I learned in business school was that, be any shade, but don't be beige. Meaning, have passion in life or not, but just don't be like, don't go through the motions and be beige.
Stand out.
And when I went in for the interview, everything in the room was beige. But my dad said, take the job and you'll get some experience and then you can move on. And here we are 4 decades later. But
amazing.
It was a window that I believe, God was opening and said, okay.
Well, you saw a need and you had the passion, the heart for it, and the opportunity presented itself and you stepped into it. That's kind of what I'm hearing from that.
It was. And what
it takes courage, really.
What I really noticed from day one of my, working was that this was a community thing. It was a real community thing is how hospice works. It's pulling in resources, that not making new ones or having to buy things, but really using their on the ground resources to make people help each other, to be a great neighbor and to really be brave enough to care. And you always start with what you know best. And so I started at my church and the groups that I was in I was in my 20s. What did I know? And, essentially said, I need some help. And people wanted to help. Yeah. But, you have to ask. Yes. And then, the church responded in a big way in Preston County. And
amazing.
And so then, we got some recognition. And then people in Taylor County said, hey, we hear what you're doing over there. Is there any way you do it over here? And then county by county, it just kind of spread like that.
Well, it seems like, healthcare, especially end of life care, hospice, what you do is so important in the community. We have to face the fact that we all die at some point, right? And we never know the time where our name is going to be called, right? And so the idea of being able to do this and combine your passion for healthcare and your heart for people and the business side of things, because it is a business. West Virginia Caring is a 501c3 nonprofit, not-for-profit organization, but you still have to make a profit or surplus, as they call it, right, in the nonprofit world to keep going. And to be able to do it since 1983 is just it's nothing short of a miracle in itself.
Well, I think it really has. There's a lot of people to take credit for that, and it started with an N of one, but it became an N of many. And then I find when you give God credit and you really you don't believe your own press, and you just realize that this is if you look around and you see. How much you've been blessed and remember that and stay humble, confident, but humble.
It's truly a calling.
Yeah.
Yeah. That's amazing.
It really is.
Doing God's work. Yeah. I appreciate that for sure. This is Positively West Virginia. We'll be right back.
Your prescriptions are designed to keep you healthy, active, full of life. At Highmark Blue Cross Blue Shield, we're making vital medicine more affordable. Because when your prescriptions don't cost an arm and a leg, you can use those limbs for something more meaningful. Because life. Highmark Blue Cross Blue Shield, West Virginia.
Folks, we're visiting with Malene Davis. She's the founding president and chief visionary officer for West Virginia Caring. They're based out of Arthurdale, West Virginia, which is, of course, is in Preston County. Malene, tell us a little bit about the different things, that you provide. We talk about hospice as a global, thing, an entity, but in a service. But what are some of the things you're known for?
So I think that West Virginia Caring, because of its roots deep into the community, and we serve 12 counties.
Yes.
So we start in the north and we go clear down to the geographical center of the state. And so very different neighborhoods and things like that. But I think that we've been known for, and we've received awards for great quality of care. So really going beyond. I think one of our slogans is that we take care of our patients like they were our own mom or dad. So if you have a really wonderful feeling about your mom or dad, we teach our group and equip them to go in and be like that. So hospice care is definitely, and we try to keep people in their own home. So we try to start to maximize services from a variety of different team members to make sure people have and are equipped at home with what they need. And we have even actually designed a special, it's called the Design of the Visit, or the Perfect West Virginia Caring Visit. That is a proprietary thing that we've kind of home baked over years. And so we teach our staff exactly, because people come in from different walks of life, different medical fields to work with us. And not everyone has had this experience. So even though your name tag says maybe hospice nurse or social worker, really you're not that yet, because there's this university of learning that must be put into place. So I'm really into education. We also do, Jim, what is palliative care. So when people are still being challenged with treatments and going through that, but they need support to be able to, they're fighting and they're trying to win, and we want them to win and we want them to feel good, because we know that, it's, if you are in pain, you're not going to get out of bed, which is not good for your lungs, which is not good for your legs, which is not good for your back. It's not good for your brain.
Yeah, exactly.
One thing's connected to the other. So we really try to get people as healthy as they can be. And then later, maybe 2 or 3 years down, we've been watching them all the time. And if things start to change or in a decline kind of way, then we insert ourselves with the hospice care, which includes counseling and again, family counseling and support, because in hospice, the unit of care is the patient and their family.
Yeah.
So we consider the whole group, because if you've ever had anyone sick in your family, that pit you get in your stomach, like, oh my gosh, what's coming, or, dread.
Absolutely. Well, you didn't know this, but last night I was thinking about our interview today, and in my dream, West Virginia Caring appeared, and it goes back to February of 2020, and my dad passed away, and he was in a nursing home. My sister and I weren't able to take care of him, but he was in a nursing home, and we got that call that Thursday morning that he had passed, and I just got in my truck and drove right to the nursing home. And when I walked in the room, there's my dad, and there's 2 West Virginia Caring nurses at his bedside. And they were standing there praying over him. And my sister walked in at the same time, and here I am. And it was just, I couldn't believe what I was witnessing. But the one thing that I took away from that, and I've shared this with you before, and this was in my dream last night, I relived it, and was the fact that my dad didn't die alone. He had those 2 West Virginia Caring nurses, those hospice nurses at his bedside. And wow, that was reassuring to me. I hearkened back to our last conversation that I had, that, that all came flooding back to me, the memories of childhood and everything, but knowing that he didn't die alone, that was so powerful. And I feel like, that just that one thing, all the different things you talk about, palliative care and hospice and bereavement and all that, but just knowing that he did not die alone is something that I just can never be grateful enough to you and your team for that. And I think, we talk about hospice, and it's a word that people sometimes may be afraid of, because they don't want to think like, oh my gosh, that's the end or whatever, but it's actually an important thing. It is an important component of life, dying, right? And making sure that it's done well.
Yes.
And I think that's what hospice is all about.
Yeah. The word hospice is a Latin word that means host and guest.
I did not know that.
So hospice really has its derivatives from hospitality, if you will.
Okay.
And this idea of really making people comfortable in whatever setting that they're in. And so, it goes back to the Middle Ages, when hospices were a place where weary travelers would stop for the night and so forth.
Yeah.
And then later became homes for the sick and the dying.
Yeah.
Now, of course, in the United States, it's been since the 70s, but when it came over from England, then England did not do the home concept like we do in the United States, where everything we do is really like my offices. We have 6 offices throughout our 12 counties. We go out. Everything is out. So if you were like knock on the door in the afternoon, it's like a ghost town in there because no one's there. Except for, of course, our inpatient center that we have in Elkins. And I can speak to that. But I think that, the idea that people have very comfort and loving feelings at home. Now, your dad was in a nursing home, but everyone's case is a little different.
That's right.
But predominantly, I mean, I'm sure you and your wife have a great house. Why would you ever want to leave it?
Right.
You made it so good. Why would you? And our goal is to try, and our vision, if you will, is to try to make that happen for as many people as possible.
That's powerful. Yeah. Because you hear people say, I'm not going anywhere. I want to die right here. This is where I live my life. And this is where I want to stay, and breathe my last breath.
And we get it, right?
Yeah, absolutely. So I do want to go back and visit the hospice center in Elkins, because that is a big deal as well. Can you talk a little bit about that and what that means for the people here in West Virginia?
So the Elkins Center, nestled down there in Randolph County, we had a relationship with a personal care home down there, and the owner became sick, and we acquired this center, and we renovated it and built some office space on the side back in the early 2002 time frame. And so, and it was kind of situated in our service area at the time, where we thought, this would be a good place. The opportunity arose, and things made sense back there. What's that, like 20 some years ago now, right? Almost 25 years ago. So it's a 12-bed private inpatient center. People from all 12 of our counties go there. I mean, it's just amazing. They can go there for a tune-up, what I call a tune-up, where you might come in and you might need some hydration, you might need a medication change going on, something's not quite working, maybe your family needs to catch up a little bit on how to do this, so you might be there for 2 or 3 days, go back home or go back to the setting where you were. And then it's also used for families who need a break,
almost like respite
care. And they can stay for 5 nights. And the nurse to patient ratio is very small. So people get a lot of attention, which is awesome. I mean, there's someone all the time, and in your room, and just kind of, making sure that things are as they should be. And they have flat screen TV, and they get 3 meals. And if they want a piece of pie at 3 a.m., it is there.
That's awesome.
If they, want things, coffee or whatever. And, each room has like a really comfortable lazy boy for the family, and sometimes if there's a couple people, we'll bring another one in, and for them just to like kind of relax as well if they want to visit. And if they want to spend the night, they also can. But that has been just such a godsend because, families over time, so now you're thinking 25 years ago, it's a different generation taking care of the sick. People need to work. They need to know that things, they need advice, they need wisdom, they need coaching on what do we do. And so, if people can come in, things get a little bit better, then they go back home, and then the home team comes right back in and takes over where they were. So it's a very seamless continuum of care. We, in West Virginia, there are only 6 of these. So mine is one. There's one in the other populated cities of the state. And so it's not overdone, but you'd find that pretty much across the country, in that not every hospice has one. It's just not in some cases, it's not the business proposition for some hospices because they have ownership outside the state. But then for us, it just made sense. And it is 7 days a week, 24 hours a day. There's somebody there, there's a chaplain there that visits and kind of goes in and out.
Kind of builds on the faith-based nature of West Virginia.
It does. It has beautiful showers. It's kind of spa-like in that way. And
sounds wonderful.
Yeah, it is. It's nice.
Thanks for sharing that. This is Positively West Virginia. We'll be right back. Stay connected with an unbeatable deal from Breezeline. Voted best in Mountaineer Country for their reliable, high-speed fiber internet for a low cost, Breezeline is the best gig in town. You know, here at InnerAction Media, we rely on high-speed internet every single day to ensure we can deliver the best content possible for our clients and when we publish Positively West Virginia each week. That's why we use Breezeline. It's affordable, fast, and they're great people as well. Learn more about Breezeline's internet, TV, and mobile options at breezeline.com. Folks, we're visiting with Malene Davis. She's the founding president and chief visionary officer for West Virginia Caring, based out of Arthurdale, West Virginia, right here in Preston County. Malene, what is the thing you're most excited about for West Virginia Caring right now?
Well, you and I were talking about our inpatient center in Elkins, and that it has been such a blessing to all of our counties, but it's not always conducive to someone who lives in the north central part of West Virginia, in Monongalia County, Preston County, Marion, Wetzel, Barber, Taylor, that we are accustomed to coming to Morgantown. My dad used to have this adage, and he would say, the road from Masontown to Morgantown is shorter than the road from Morgantown to Masontown. we are used to coming to this destination for a lot of things, you know? Yeah. And so I think that we have really missed having a hospice center in this area. And so last year, by the grace of God, we purchased a building that our vision is to make it into the first hospice center in this area. And it has the support of all of our health systems and a lot of different folks. And so we're in the planning stages, but we do have blueprints and things like that are coming together.
Yes.
And so we're going to be looking for some financial support, of course. Yeah. But I'm really excited about it because I really feel like people need a place to make a pause or take a stop and get some things tuned up, you know, to perhaps a little slow down to say, okay, you're not ready to go home yet. Let's come here, and then let's see what we can do. And then our goal still remains to get them, you know, back to where they came from. Absolutely. With the support of hospice care.
Will this also be a place of respite for families too? Like we had mentioned in Elkins, will that be a part of the programming?
It will. It will. We'll have some respite opportunities there. Yeah. I think that the one in Morgantown, my prediction is that it will be more for the tune-ups and people that are probably a little more intense than the home care patient situation is. Right now, we have folks that come to us directly from the hospital, so we did not have a relationship with them before, and the hospital is in a place where they need them to move to the next, to transition to another place, but home is not the option yet.
Yes, so this will almost be like a transitionary period for them to, as they prepare for the end, so to speak.
You know, you and I have the flu. We might get over it in 3 days or so, like that. One of these patients who are immune compromised and just don't have the strength, you know, it could be weeks or something like that.
And it's not necessarily to the level where they need to take a bed in a hospital. They can come to the hospice center for West Virginia Caring and rehab, if you will.
And their family will be comfortable there. That, you know, we're going to have a family kitchen. We're going to have a
state of the art.
It's going to be hospitality, everything hospitality, and where any family will feel comfortable there.
Are you able to divulge the location?
Well, we purchased last year, and this is kind of public knowledge, but we purchased the Friendship Manor building on Van Voorst, which I call it the property that God picked out.
That's right.
Because I had looked the world over, if you will, and nothing was really clicking the way this did. And so I can almost look at both hospitals.
Yeah, if you're on the roof, you probably could see both from there, vantage point.
And seriously, that it is where you want to be. It's kind of out on the fringe, where you don't have to get over into the excitement that goes on in front of the, all the. But at the same time,
you're in the thick of it.
You're in the thick of it. It's quiet,
easy access.
It's easy access for people, no matter what their age, and getting
That's
there.
Really good.
And so, and we've learned the things. We've had this for 25 years in Elkins, and I've been to probably 100 of these different centers across the country. So we really can pull together the best ideas on what that looks like, and put that in together, the best resources. And because of my business background, I love not duplicating things, but using things that are already existing in the community, whether it's food or laundry or things like that. So we will outsource things to, just
that's great.
Make sure the investment really is being not duplicated from things that we already have in the community.
Stewarding the resources. I like that a lot.
Yeah.
Malene, you've been in this realm of hospice care here in West Virginia since 1983 or so. What's one of the most interesting things you've seen? Like maybe out there, it's like, wow, I can't believe I got to witness that.
Well, I think that one of the most interesting things in healthcare, of course, is going through the pandemic.
Yeah, gosh.
That our hospice center in Elkins really became a haven, if you will, and a help to healthcare in that area, well, everywhere, to be able to take some of those patients on and really just care for them, isolate them, but yet still make it meaningful to their families and not as scary. And so we really had to kind of repurpose ourselves, because that's not really what we did, but we learned along everyone else. And the hospital systems were just so grateful to us to, get that going and be able to maneuver and navigate that. I think that the pandemic is probably one of the most interesting things that I saw. And I thought that West Virginia communities and our local communities really did a good job by just pulling resources and information and getting on the phone once a week, all of us. And we serve 12 counties, so we were on this phone call and then down in Randolph County and down in Burnsville and different places to try to connect,
trying to figure it out.
And the health departments and, what are you doing? What are you doing? Are you still wearing masks? Are you still wearing this?
Yeah.
And, one of the great blessings of West Virginia Caring, I really count as a blessing, is that about 60% of the people that work for West Virginia Caring have been there over 10 years. And then there's a smaller subset that have been there over 20 and a little bit over 30 years.
Wow.
And so we have this long tenured workforce that really care. Yeah. They are really brave enough to care. They put things aside. It's not a punch in and out job, as you can imagine, because we are very involved in our community, not because we always need to raise money for this or that, but really we want to go where people are and find out, if you like to golf, okay, we're going to have a golf tournament. And while you're there, you're going to learn at least one thing about end of life. Yeah.
You also have some stores throughout the community, and you have a bereavement program for kids. Can you talk maybe a little bit about those programs?
Yeah, in 1995, I had a bereavement coordinator, and I sent him off to another state in Kentucky. Actually, Kentucky it was. And I said, they're having this bereavement camp. I want you to go attend, and then write down everything you can. We're gonna rip off all the ideas, and then we're gonna have one here. And that's what we did. And it really grew. And it was called Camp Nabe in the first, Nabe, which is a Korean word that means butterfly. Because as you address an issue, a social issue, things can actually bloom and become a beautiful thing, which may have not started that way. And so now it's called Camp Caring, because we had kind of rebranded ourselves in 2016. And so again, we bring community resources together, volunteers to come. We connect them with a kid. And these aren't just from our hospice families. We have kids coming from the Carolinas, Pennsylvania, Ohio, and a lot from West Virginia. And they come and they just learn a little bit about themselves. There's some personal growth that happens for them to realize that what you're going through is a shared experience.
Yeah, the others are going through it. Yeah, and so this could be somebody who is a child who has lost a loved one, and they're having a difficult time processing it, basically.
Yeah, and it's interesting. Since 1995, back in 95, it was your grandmother died, or your neighbor who was elderly died, and you're just trying to get used to that. Over time, there have been other tragedies that have happened, and then fast forward to the last, even, before the pandemic started, I still kind of use that as my benchmark, but, we have addictions and things like that have happened in families that kids need, again, and we use fun things to get to them to open up, and then they have a mentor or a buddy the whole time that we've trained specifically. So it's not like these are serious. We really go into depth in their training to say, okay, and then we meet at night and talk about what it was, what came up for that, and get ideas and exchange ideas and then address them the next time. So in the beginning, we were kind of a whole weekend camp. We've kind of cut back since the pandemic, and it's more of a day camp because again, we're just trying to keep up with the American family and what fits,
Yeah, that's great.
But,
and kind of got you off track with two questions, but I also mentioned the thrift store concepts. You maybe talk a little bit about that.
Yeah. So, way back when, people would want to give us things because they are so grateful. They have these huge hearts about and people would want to give things. And so there was a concept that I had seen actually in Florida that they had opened a thrift shop. Yeah. And it was kind of an ongoing fundraiser, if you will. I mean, we don't, we're selling 50-cent items and $1 and things like that. But the people that work in the thrift stores are mostly women. There have been some men, but mostly women. And some of them are from our bereaved families. Oh my gosh. So they end up becoming almost a support group for each other. Wow. So we have one in Preston County in Reedsville. That's our oldest, Fairmont. And it's so funny, I'll visit a doctor. I was visiting this nurse practitioner in Fairmont. She goes, "Are you the one with the thrift store?" And I was like, "Yeah, we are the one with the thrift store." And then we have one down in the south in our Burnsville location. Yeah. But people bring a lot of things in. That's so cool. But then the volunteers that are there, and the volunteers have a ball. They just, they laugh and they just share. Yeah. And, we always have some snacks and things in there.
Well, it fills multiple needs in the community, right?
It does.
So you have the thrift store, but you also have this community of people and volunteers, but you're also using it when people come in to tell the story of West Virginia Caring.
Yeah, there's always information there. Yeah. And so we do give our volunteers some sound bites to say.
Talking points,
yeah. If someone comes in and says, my husband's got this or I've got that.
Yeah, that's important.
Then, you don't have to know the whole 301 class, but you can give them this. And then they can call one of us and we can get them.
It truly is an entrepreneurial venture, with all the things you're doing. Malene, if somebody's listening to this and they've heard hospice and maybe they're thinking of this for a loved one, what would you say? Like, what's the best piece of advice for people to get plugged into hospice sooner rather than later? What would you say to them?
It's the question that's been asked for a long, long time. And the number one complaint of hospice across the country is that we wish we would have known about it sooner. And I think that probably now, people overthink it. Don't overthink it. We'll be the first ones to tell you, come out and talk with you and evaluate and say, this is way too soon, but here, let's get you connected with other things that can help you right now. Or we could say the timing is perfect. And by virtue of this and that, and by the way, did you know that you're not going to get a bill for $1 from us for all of this care? Because
how is that?
Because it is the number one way that hospice is reimbursed and paid for in this country is through Medicare Part A. So Medicare Part A, if you go back to 1982, Ronald Reagan is the president. He and Bob Dole and these guys said, we've tried this, we've seen this hospice thing working since the late 70s, came out of New Haven, Connecticut. And they said, what if we tried to pay for it a little bit? They still have to use volunteers and be very involved in the community. And they still have to have a whole team of approach. But what if we started doing that? And so these volunteer hospice programs like mine then started, getting some infusion of financial viability. And then oh my goodness, all at once I wasn't the only nurse. Now I had another part-time nurse, and she and I would do all the call and go out and see all the patients. Yes. And then we had an aide that joined us and a social worker. And, it just started like that. Now, Medicaid in the mid-90s in West Virginia mirrored that. Yeah. And commercial insurance is pretty much all mirror Medicare and pay for hospice. Sure. But
so in essence, if people are working and they've worked at some point in their life, they've already paid for the hospice service and there's no out-of-pocket. Is that fair to say?
That is exactly fair to say.
Yeah,
in fact, nothing makes me, more happy when I go in and speak to a gentleman about hospice care. And I said, now I'm going to explain this program to you. But the first thing I'm going to tell you is that this is not going to cost you a dime. And the men, you can just go, phew.
Wow.
Because, sickness is expensive.
Yeah, of course.
Even if you have insurance.
Yes.
There's a copay and there's a 20%.
And this and that. Yeah. All these. Yeah.
And
exactly.
it adds up. And people have watched their life savings and things that they had hoped to pass to their children go, evaporate.
Yeah.
And what happens with hospice comes in is that maybe you were paying $300 for your oxygen every month. And now guess what? I'm going to take that bill away from you.
Yeah.
And you've been going to the pharmacy to get your, underpads and things like that now you need. Guess what? That you're not going to have that bill anymore.
Wow.
And to top it all off, the cherry on the top of the sundae is then I'm going to send in someone who's certified in this field to come, which is something that's very important to me.
Who actually cares.
Yeah. And they're going to come in and we're going to develop a plan with you together. We're not going to tell you what's happening. We're going to do this together. You tell us what days work for you and we'll tell you if that works for us as a family. And we're just going to go out through it. And by the way, if something goes bump in the night, you can call us any time of the day and we will also talk you through that.
Yeah. And you, as I understand it too, you're able to some degree, be able to, if somebody wants to go out and hit their favorite fishing spot one last time, you're able to help and assist with those kinds of things too.
That's my favorite stories, Jim, is that, when we see somebody get up out of their house and they go, and, we have people that will, during the winter said, okay, I'm going to go to Florida. So then I would call a hospice in Florida and say, they're visiting here for the week. Can you watch after them or can they call you if they need something? Sure. And we have a little exchange of paper and it works.
Amazing.
My favorite story though is an 8-year-old. We have taken care of children the whole time. So this is not just one of my first patients in the 80s was a 16-year-old living in Horseshoe Run, deep into Preston County. And I was there and their parents are there and this long 16-year-old kid is laying on the couch, no hair. And I thought, boy, I was not prepared for this. But you know what? Showing up is sometimes what you do, just showing up. But we took an 8-year-old from Terra Alta sled riding in October at the Wisp ski resort. Yeah. And we went up, one of my social workers, I give total credit to them. They went up and it was getting cold at night, just like it's still a little chilly. And they made snow on one area. And on that Sunday when they went sled riding, there wasn't a dry eye in the place. This little girl with her sisters, 8 years old, went down and up and down and up and went sled riding all afternoon. And that, she ended up dying, I think, later November. But that she got to do that. And then we've had proms, makeshift proms for 16-year-olds who wanted one last dance with their dad. Talk about it just really, but that's why we stay in this.
Yeah.
It was what brings us to work out of bed every morning and say, this is really important.
That's powerful. Thank you for sharing that. Malene, you're obviously a leader, a visionary, a pioneer in hospice here in West Virginia. Been at it for so long and provided so much care and support for loved ones and people in their last stages. You're an entrepreneur, right? You started a nonprofit and you have been at it for a long time. As a leader, what do you think is one of the most important attributes for a successful leader today, whether it's in a nonprofit or a business environment?
I think the most important thing is personal growth. Unless you're big on the inside, you're never going to be big on the outside. And I think starting with something that you have a passion for and starting small and really focusing on leadership and equipping people and relationships. We all communicate very well. In fact, sometimes we over communicate, but we don't always connect.
Yes. Absolutely.
And I think that connecting with folks, the leader I am today is much different than I was when you learn and you grow and things that you worry about, you start to worry less about over time I really lean into my faith.
Yes.
I think that is
it's evident.
Huge part.
It's great.
But
Appreciate that.
it kind of goes with the business, but it also goes with who I am. And I just love to see communities really be at peace and really think about selfless acts.
Yeah.
How can I help my neighbor? And what are they eating?
Yeah.
Who's taking care of them?
It goes back to that story you relayed of having a little care pack when you were a nurse and, seeing these oncology patients. And that's what went through my mind when you're saying that. So
it was, I was scared for them.
Yeah.
At that time, I was scared for them.
Of course.
Now I know. And what's so wonderful is being able to look into the eyes of my own staff, and they are just as eager to go as I am eager for them to go.
That's amazing. Yeah. I love that. That's incredible. So speaking of entrepreneurship, what kind of advice would you give somebody thinking, hey, I'm out there, I'm listening to Malene, she started this thing, I've got this idea. What would you say to that person thinking about taking a step into starting something?
I think that having a passion about something and starting small, don't go too big, but I think the most important thing is to find a great mentor. Somebody may have not done it exactly like that, but if you see somebody blooming and prospering, getting to them, to talk with them, pick their brain about what missteps they made. I do it all the time. People say, what would you have done over? Oh my goodness. Do you have a week?
Let me get my list.
Do you have a week to talk?
That's me.
But, at the same time, it's great because I think about, I did this and I wouldn't have done that. Or there's a time, you start thinking of your own, believing your own press or whatever it is that, you really just work it. But equipping others, I think learning all the time. I read and learn things all the time. I want to stay up. And then I don't keep it inside. I pass it on to my people. Like, look at this, read that. I'll be sending out an article from, John Hopkins or Duke or, someplace, Cleveland Clinic.
Well, one of the best ways to learn something is to teach it, right?
And I love that's really great.
You read something and then if you share that and then you're actually experiencing it a second time or third or, what have you.
But I had great mentors in the state. They've since long retired, but I really humbled myself and thought, okay, you don't know anything yet. So you need to get to the people that you can see they're thriving. And I did. And I followed their floor plan, their blueprint. And then I started to build on that blueprint.
I think, being in proximity with people that are doing it is powerful, and I think a lot of people are hesitant to do that. Well, they're not going to share with me. They don't want to help me. But I think if you just ask and you shall receive, that's a biblical principle, right? And so, seek and ye shall find, right? I mean, you have to go out and put yourself out there, especially thinking about starting something. So great wisdom, great advice. And I appreciate that. Malene, we've covered a lot in this interview. Is there anything you think our listeners should know about you personally, your story, or West Virginia Caring that we didn't touch on?
Well, I think that for me and my family, that we have certainly lived the hospice experience, and that my dad was a hospice patient, my mom, aunts and uncles and neighbors and folks around us. So we really have been through treatments and visiting the hospital many times and going to specialists. And so we really, it's not something that we think we know about. We really have experienced ourselves. So I think that's after you've done something for so long, you should be good at something, right? And I think that I really can understand and have empathy for where people are going through and what they do. And I think that our patients and families really benefit from years of experience and wisdom, trials, and working these things out. And then we just keep paying it forward and equipping families today. So the families that we have today are getting so much more wisdom accumulated over time.
Sure.
And I think that
it's exponential. Yeah.
it's exponential. And I think that at the end of the day, if you can find what your purpose is in this world and you can get your head around that, and this whole life is played in your brain, right? And so I think that if you have peace and you take it, if you find your own peace and you take it with you wherever you go, that you come into every relationship or every conversation, and that it just shows that, I am really about a win-win experience. I don't like win-lose. I like win-win.
Yeah.
I want people to win, even though that may mean that people ask me all the time, why isn't it depressing to work in that? But the thing is that when people are sick, it's like my dad said, I heard him say to my mom in the living room, Irma June, this isn't living.
Yeah.
And it really probably was the most helpful thing to me, because what he was saying was that if I was going to get better, I would want to linger on, but I'm not. And so I want, the most care that I can get on this day. And I want to live all the days that I have left, and we all know God has the final say.
Exactly.
However, I really understood my career path even more that day when my dad said that. I thought, wow, it's not sad when someone who's not able to do the things that they want to do, and if they're ready for their new location, be it, my organization, because we believe in heaven, we believe in God, and that's our basis of how we do that. But we accept everybody where they are.
Yeah.
But that's our direction.
Yeah, that's
and so
amazing.
I think that's who I really am.
Yeah,
and that's what I believe in.
I love it. Thanks for sharing that, Malene. As we close out our time, how can people learn more about West Virginia Caring and maybe even get in touch with you?
So our website is very accessible, and it has a lot of information. We put videos on there so families can just kind of click in and watch and see and things like that. I think my best advice is that if you have any questions ever, the only dumb question, remember that, is the one that not asked, right?
That's right. Yeah.
So it's really very, calm and simple just to call up and talk to someone, and we will give you advice. I'll have people here locally say, will you talk to my mother in Illinois or my aunt, my uncle's having trouble? And I'm like, sure. Wow. And we get on the phone and I'll tell them what questions to ask their hospice, and what works, because hospice should be about the same wherever you go, except that I think that programming, not every hospice is going to have an inpatient center or want an inpatient center, because it's just the right thing to do.
Yeah, that's great. Well, Malene, it's been my pleasure and honor to have you here in the studio to discuss West Virginia Caring. I think what you're doing is amazing, and I just want to encourage you to keep up the great work.
Thank you. Thank you, Jim.
Absolutely. Folks, this has been another episode of Positively West Virginia, and we hope you've enjoyed our discussion with Malene Davis, the founding president and chief visionary officer for West Virginia Caring. If you or someone you know would be a great guest on the show, drop us a line on our website at positivelywv.com. Of course, we appreciate your comments, your sharing these great stories just like Malene's, and getting it out there into the world here in West Virginia and beyond. On behalf of our entire Positively West Virginia team, including our producer today, Mr. Jimmy Murray behind the controls. Jimmy, thank you very much for making us look good and sound good. I'm your host, Jim Matuga. Stay positive, West Virginia.
We'd like to thank our partners, Highmark West Virginia, Freedom Key of Morgantown, InnerAction Media, Storymaker, and our studio sponsor, Breezeline, for helping to share these positive stories. If you'd like to become a sponsor of the Positively West Virginia podcast, visit positivelywv.com/sponsor.